Hi, I'm Dr. Fred Echols, the Acting Director of Health for the City of St. Louis. Over the past week, we've received several questions from the community about school reopening. So today, I'm going to take a few minutes to answer those questions. COVID-19 testing for school staff prior to schools reopening has been recommended by the Health Department. Some schools in the City of St. Louis have announced that they will be beginning the semester virtual. Does the Department of Health still recommend staff at those schools get tested? The answer is yes. So although schools will be opening virtually, some staff will still be required to come into the facility either for professional development or to provide instruction for their students from afar. So for those individuals, we still recommend that they get tested before going into the schools and then interacting with their colleagues. Knowing their COVID-19 status before they re-enter the school can prevent the spread of COVID-19. For example, if a staff tests positive, they can be excluded and undergo the required isolation period before being cleared to return to work. Again, this is really important to prevent the spread of COVID-19 amongst staff that will still be required to go to the facility to provide instruction. Face coverings and masks for employees during work hours are being enforced. What else needs to be done to protect the workforce? It's really important to enforce facial covering, social distancing requirements while in the workplace. However, what we are seeing is that the exposures to COVID-19 are also occurring in our community. And so while we encourage staff to be vigilant about wearing facial coverings, physically distancing themselves from others, wiping down commonly touched surfaces frequently, we also ask that they do that not only in the workplace, but also at home. When is someone infectious if they have the coronavirus? So after someone becomes infected with COVID-19, it typically takes a few days for the virus to replicate or reproduce and for the body to mount an immune response. So typically, again, it's a few days between when they're exposed and when they become infectious. For COVID-19, the incubation period, which is the period between when someone is exposed and infected and the time when they develop symptoms, is 2 to 14 days. So we're actually really cautious about our isolation and quarantine for individuals that have been exposed because they can develop symptoms and become infectious at any point in that time period. Are children less likely to contract COVID-19 or merely less likely to show symptoms? Studies have shown that anyone that is exposed to COVID-19 can become infected. However, our younger populations, including children, oftentimes less likely to develop symptoms. So sometimes they can have no symptoms at all and still be infectious. And that's why it's really important for us to be mindful of the facial covering requirements as well as the social distancing requirements and cleaning requirements, not only in our workplaces and in schools, but also in our homes and in the community. School staff were experiencing burnout prior to the coronavirus. Are there free behavioral health resources in the City of St. Louis that school staff can access? Absolutely. So the City of St. Louis Department of Health has partnered with the St. Louis Mental Health Board to make mental health services and behavioral health services available for the community. People that are interested or people that need to access these resources can do so through United Way 211. I'd like to thank everyone who sent questions and all of you for tuning in. I'm looking forward to next week's questions. I want to hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Questions will be answered in the order they come in. If I run out of time on air, your question will be answered by return email. Be well.